Hey, let's talk patellofemoral pain. Let's talk about what it is, what causes it, and how you can get rid of it without pain meds, injections, and surgery. So first, what is patellofemoral pain? Well, patella is just a fancy word for the kneecap, and then patellofemoral is the joint that the kneecap is aligned in, which is the femoral means femur, which the thigh, your thigh bone is called the femur. So it's a joint between the kneecap and the femur. And as you move your knee, as you bend it, the kneecap should come down. And as you straighten it, the kneecap comes up. Now, there's two main things that I find is typically the cause of this problem. But first, what is it? Patellofemoral pain syndrome is saying that the cartilage within that knee joint, so it can be the cartilage that's on the underside of the kneecap, or it can be the cartilage that is within that joint that lines the femur bone. They become irritated, inflamed, and they lead to pain. Now, this is more typical in a younger population that's more active than, say, an older population, but it can occur in anybody. A lot of times people will complain of some sort of a burning sensation deep to the kneecap, or it can just be pain that comes on gradually. Usually it's going to be with some sort of bending motion. So with running, hiking, stairs, squatting, lunging, anything that you have to repeatedly bend that knee and come up and down can start to cause knee pain, which is known as patellofemoral pain syndrome. So the two main causes that I see why this occurs is either a stiff joint, and it's one of two joints. It's either the ankle or the knee, or we're going to have some form of weakness. Either the trunk, the hip, the knee, or the ankle is going to be weak. That's going to cause some knee compensation. So let me talk to you exactly why this is so important, why looking at the whole leg is so important. So as we take a step, every time that you take a step or go up and down stairs or run, it doesn't really matter, but every time that you step forward, it really requires the ankle, the knee, the hip, and the trunk to work as a single unit. So every time I step, the thing that what's going to work first is that ankle has to stop me from falling forward, and then the knee, the hip, and the trunk are going to keep me upright. So if there's any sort of weakness in the trunk, hip, knee, or ankle, it can start to cause knee pain. Typically the area that hurts is just hurting because it's overworked because of a problem somewhere else. So as far as stiffness, the first thing I want to look at when somebody complains of patellofemoral pain syndrome is knee stiffness. What I typically find is associated with this problem is they'll be lacking the 5 to 10 degrees of terminal knee extension. Now, you can't test this by yourself, but you can grab somebody else and you should be able to place a hand here to hold down and then at the same time pull up here. And you should be able to get 5 to 10 degrees of knee hyperextension. And if that's not present, what it can be doing is placing more stress on this kneecap. And as you straighten that knee, it's not allowing it to slide and glide as well as it should be, and it can be grinding within that joint that's causing cartilage irritation. So that's the first thing to look at. The second thing to look at is there enough ankle mobility? So you need some flexibility every time that you take a step forward. This is called ankle dorsiflexion, and there is a quick way to test it. So let me show you that now. Okay, so what you're gonna do is come to a wall. You're gonna go shoe off, and if I'm testing my left ankle, then I'm gonna put my left ankle close to the wall. What I'll do is put a fist towards the wall, against the wall, and then my big toe should be touching my fist. And then what I'm gonna do is push my knee into the wall without the heel coming up, and make sure that you're keeping the knee is not caving in, it's staying straight over your big toe and you're pushing forward. You should be able to touch the wall with your knee without your heel coming up. Okay, and so if there's no knee stiffness, no knee joint stiffness, and you're able to extend that 5 to 10 degrees, and there's no ankle stiffness, then we're going to start looking at, is there any weakness at the ankle, knee, hip, or trunk? And start fixing whatever it is that we find to be a problem. Because pain really is just, it's a sign that there's a problem, but it doesn't always necessarily tell you what the problem is. And depending on what activity causes the knee pain, that's going to make us look at different parts of the body. So if there's pain with running, then we have to think what activities are required for, or what body parts are required for running. Well, it's the ankle, the knee, the hip, and the trunk. If there's knee pain with squatting, it's the same. It's the ankle, knee, hip, trunk. So we really have to start to question, why is the knee pain occurring, and not just assume that the knee is the problem. Anytime that there is pain in the knee, we've got to question where it's coming from. Is there an ankle problem, knee problem, hip problem, or trunk problem? Listen, if you're dealing with patellofemoral pain syndrome and you want to overcome the pain conservatively without pain meds, injections, or surgery, then go ahead and click a button around this video and schedule a call with the clinic. And we want to ask you some more questions about your problem to see if our treatment options are the best approach for your problem.